There are over 200,000 women that are diagnosed with endometriosis each year. Could one be you? What is endometriosis? That's the question that I had to ask when someone told me that I might have it. Because of the journey that I've had with my endometriosis, it inspired me to create YouTube videos to bring awareness to the condition, hopefully to help someone that might have the same um, concern or same symptoms or might be questioning if they might have it as well. So today we're going to talk about what endometriosis is, what are the symptoms, how to be diagnosed, and the treatment that's available. Hi everybody, my name is Star and welcome back to my channel. So again, today we're going to talk about what endometriosis is. Endometriosis is a condition where your uterus, the wall, I guess you can say, of the uterus or the lining accumulates tissue. That's like the term that you would find like medically or online. I am not a doctor, and so I don't really like have too much experience with like explaining it, other than like the layman's way, which is, like basically when once a month when you get your period, it's like basically instead of the blood leaving your uterus like it's supposed to, it stays inside the uterus and it clings to the wall of the uterus or on the ovaries. It doesn't just leave there, it can actually go in other parts of the body as well, like the bladder, the stomach, and there's been some cases where it's been way off, from there as well. So that's basically what it is in a nutshell. It's like basically the tissue, it clings to the body. What causes the pain is that the tissue inflammates each month, and so with it expanding, it also connects. So like imagine having a puzzle, like a 45 or 100 like piece puzzle that just kind of clings together and then expands, and so that's basically what it is. And with the inflammation, it brings scar tissue, and it can cause a lot of pain on top of the pain that you might already be experiencing from regular cramps. So that's like what endometriosis is. What are some of the symptoms? Well, the cramping, of course, but it's not like, I don't know what normal cramping is because I've never really experienced it at all. And it's like, from what I've been told, it's like normal cramping is like manageable. You can still go about your day and stuff like that. So it's like it's kind of beyond that. And also there's, you might experience headaches, dizziness. For me, I used to have vomiting spells. Like I would have to vomit after experiencing like the pain and stuff like that. So it's a lot of like, the only way that I can describe it is pain, like cramping, pain, and how you can be diagnosed. The only way to be diagnosed is through the laparoscopic surgery. For me, I went through many different doctors, and I just want to put a disclaimer in here. With endometriosis, it can be considered hard to diagnose only because the only way to diagnose is through the surgery, and that's one. And then two, it is kind of pushed under the rug. Like I said, I've had it for a long time, and I was never diagnosed, and it was kind of, oh, well, she just can't handle her period, or she gets really bad cramps. And so what I would recommend is, just continue to talk to your doctor, or if you have to change doctors, do so. I know when I finally got to the point where I was like, I have to have the surgery, I went through many different doctors because no one wanted to tell me that I had endometriosis and or diagnose me. or they did ultrasounds and all these other tests. But the only way to actually figure out if you have it is if you take the laparoscopic surgery. Um, and as far as treatment, there are different treatments out there. The surgery is one, because what the surgery does is it removes the scar tissue in the um, and I'm like touching my stomach because I'm trying to remember what it's called. The scar tissue in the excess blood that might have accumulated over the years. So they kind of, if they can get everything, because it's possible that they are not able to get all of the stuff out, but if they are, then it can offer some relief. Birth control is another form of medication. What it does is it slows down the growth process of the endometriosis, because it tricks your body into thinking that you're pregnant, and so it slows down the process. And I laugh because it's like the only other option is another, like there's some other like drugs out there that tricks your body into thinking that it's in menopause, and I've tried both. And the symptoms for the menopause one, I had it during summertime and I experienced hot flashes, and now I do not. I don't want to. I don't want to go through menopause. Um, it was an interesting situation, but as far as that, it's like it might work for some, but that's the other option. It does give you some side effects. Not everybody experiences the side effects. I unfortunately, that was the one side effect that I did experience. I didn't like it. Uh, then the other option is like the surgery, and so those are like the three, I guess. And like there's different types of, as you know, birth control that's on the market that you can use to slow down the process. Just like there's different medications out to um, you know slow down the process of endometriosis that, like I said, gives the menopausal effect. And then the surgery, like I said, it gives it a clean slate, but you have to get on something else in order to slow down the process. And it from what I understand, it can come back. So it is something that you have to live with. And it's something that you, like, for me, I don't, well, okay, I remember life without it, but it's like you kind of, just like with any other condition, it's like you kind of, you just have to learn to live around it. And if that means changing the diet or taking your medicine and stuff like that, making sure that you do go to the doctor, it can help keep you healthy, and like I've been saying, slow down the process as well. I can't stress enough, like, if you feel like you have endometriosis, you should definitely talk with your doctor about it. Don't put it off, because the symptoms only get worse as time, progresses. So that's like basically what I wanted to share with you guys today, and I hope you guys did enjoy. I ask that you guys comment below and just tell me if you like the video, and also if you have any questions or concerns in regards to endometriosis, feel free to comment, or you can always send me an email, and I'll be more than willing to share more about my experience or answer any questions if I can. And I also want to share that I hope to be making more videos in the near future. Like I said, I feel like I would like to either inspire or help someone that might have endometriosis, or just in any way, on their life journey. So I hope again you guys enjoyed, and please remember to comment below, like, and subscribe. I'll see you guys on the next one. Bye-bye.